GMA cover story, the makers of Ozempic and Wegovy are suing clinics and wellness facilities for selling off-brand versions of their medicine. Becky Worley has the details. Good morning, Becky.
George, good morning. Initially made to help control diabetes, Ozempic and Wegovy plus other drugs like them have skyrocketed in use because they've proven effective in treating obesity for some people. But the makers of the drug have asked courts to stop companies from selling a compounded version of the drug that they say is not FDA approved. They're the drugs millions of people are taking. Also, people like Tina Shaw.
I have literally lost and gained a ton of weight over the years.
She says she first heard about Wegovy at a wellness spa. But this morning, Novo Nordisk, the maker of the drugs Ozempic and Wegovy, filing lawsuits in 4 states against wellness spas and clinics who Novo Nordisk say are using false advertising, infringing on their trademark, and unlawfully selling non-FDA approved compounded products that claim to contain semaglutide. The company saying Novo Nordisk cannot validate the safety or effectiveness of products claiming to contain semaglutide that are not one of our own branded products. And overnight, Novo Nordisk telling ABC News, we're preparing to file in the coming days legal actions against compounding pharmacies that are engaging in the unlawful sales of compounded products claiming to contain semaglutide. At the heart of the issue, pharmacies and clinics that instead of buying from Novo Nordisk compile these drugs from individual ingredients, a practice called compounding, and then allegedly claiming the medications have semaglutide as an active ingredient.
So if a patient elects to use a compounded form of the medication, we cannot guarantee what's actually in that drug.
The FDA says while these drugs were eligible for compounding because of initial shortages, they recently stated compounded drugs pose a higher risk to patients than FDA-approved drugs because compounded drugs do not undergo FDA pre-market review for safety, effectiveness, or quality. But the other issue? Price. For Tina Shaw, whose insurance doesn't cover the more than $16,000 annual out-of-pocket cost for Wegovy, her only option was to use a compounding pharmacy which sells the drug for just $300 a month. This issue is critical for the future of weight loss treatment. Are compounded versions of these drugs safe? Who will be able to afford the drugs if the full retail price of $16,000 a year is the only option? And should insurance and Medicare be covering the cost of these drugs that are proving so effective for weight loss? Robin?
You have Dr. Jen with me right now, nodding along to what you are saying there, Becky. Thank you. Thank you as always. We do have a